style question: myocardial infarction and rupture of coronary artery atherosclerotic plaque. A 58-year-old man with a history of hypertension, hyperlipidemia, and smoking presents to the emergency department with severe, crushing chest pain that radiates to his left arm. The pain started 30 minutes ago while he was at rest and is associated with diaphoresis and nausea. His blood pressure is 145/90 mmHg, and his heart rate is 100 BPM. An ECG shows ST segment elevation in leads QVF. Troponin 1 is markedly elevated. Which of the following is the most likely underlying cause of this patient's myocardial infarction? A. Spasm of a coronary artery. B. Rupture of an atherosclerotic plaque with subsequent thrombus formation. C. Coronary artery embolism. D. Acute inflammation of the coronary arteries. E. Vasculitis of the coronary arteries. Answer: B. Rupture of an atherosclerotic plaque with subsequent thrombus formation. Explanation: this patient is presenting with acute myocardial infarction (MI), likely due to the rupture of a coronary artery atherosclerotic plaque. The most common cause of ST segment elevation myocardial infarction is the rupture of an unstable atherosclerotic plaque in a coronary artery. This rupture exposes thrombogenic material, e.g., collagen tissue factor, to the bloodstream, leading to the formation of a thrombus that obstructs the coronary artery and prevents blood flow to the heart muscle, causing ischemia and infarction. Pathophysiology of myocardial infarction due to atherosclerotic plaque rupture. 1. Plaque rupture, exposure of subendothelial material, e.g. collagen tissue factor, to the bloodstream. 2. Platelet aggregation and activation of the coagulation cascade form a thrombus. 3. The thrombus occludes the coronary artery, leading to myocardial ischemia and infarction of the heart muscle. Why the other answers are incorrect? A. Spasm of a coronary artery. Coronary artery spasm, e.g. Prinzmetal angina, can cause transient ischemia, but typically does not lead to permanent myocardial infarction, like in this case. C. Coronary artery embolism. While embolism can cause ischemia, it is less common than atherosclerotic plaque rupture and typically causes ischemia in distal vessels rather than a large obstructive thrombus in the major coronary arteries. D. Acute inflammation of the coronary arteries. Viral myocarditis, or infectious causes, can cause inflammation of the heart muscle, but this would not lead to rupture of atherosclerotic plaques or cause acute coronary thrombosis. E. Vasculitis of the coronary arteries. Vasculitis, e.g. Takayasu arteritis, Kawasaki disease, can affect coronary arteries, but is much rarer than the rupture of atherosclerotic plaques in the context of risk factors like hypertension, hyperlipidemia, and smoking. Key takeaways: rupture of an unstable atherosclerotic plaque is the most common cause of STEMI. Platelet aggregation and thrombus formation lead to coronary artery occlusion and myocardial infarction. Risk factors include hypertension, hyperlipidemia, smoking, and diabetes. Early intervention with antiplatelet agents, e.g. aspirin, thrombolytics, or percutaneous coronary intervention (PCI), is critical in treating acute MI. Would you like more